Oh yes, well, we when you get a phone call to tell you that a bus has gone over out at Pimpernaya and we're expecting 40 plus people to come through the emergency department, you get no, that would certainly be a life-defining moment there. But the staff handle that absolutely magnificently. Yes, look, there are other instances where I wonder, with the shortage of specialists, for instance, and you think, well, how am I going to make sure that there's an anaesthetist or a surgeon, whatever, for this weekend? And we can't go without them. And that can be very stressful. I found that's probably the most stressful part of the job, that there isn't a reliable supply of available specialists, and that is rattling. Well, you'll be sitting there on a Monday, and you haven't got anyone there for the weekend, and the staff and the medical workforce unit, I think they've got one of the most difficult jobs in the hospital, trying to secure the service. And I'm happy to say it. Over the 36 years that I was there, the service continued to be provided appropriately right the way through. But that was extremely difficult. And it didn't start out that way in 1984. We had medicine was different. All the general practitioners, for instance, did obstetrics. Most of them did anaesthetics. They admitted to the intensive care unit. They had a lot more inpatients. They were on call 24/7. That's all changed quite dramatically, and there's medicine's become more complex and more specialised, and you need to have a physician and a surgeon and an anaesthetist and an obstetrician, specialists in all those areas. You need to have people 24/7, and that is a challenge for, not just a challenge for Wimmera Healthcare Group, but that is a challenge for the whole of rural Australia. And I'm not sure, that just doesn't seem to be solved, that young graduates just do not want to come to the country. Oh, they'll come for a rotation, they'll have a great time. We've had them here as medical students, interns, registrars, locums, but they won't say, look, I'll come to Horsham and I'll start a family here, or I'll bring my family and I'll spend the next 30 years here. When I first came here, there were doctors in each of the small towns who'd been here for 30 or 40 years. They're not here now. Well, they've gone on, but they haven't been replaced, because that type of doctor doesn't exist anymore in Australia. Oh well, that was after. I'm not sure of the exact date. You go through various stages. You start as a senior lecturer, and you then become an associate professor and a professor. That was really a recognition of the work that I'd done in quality and safety. And as I said, we'd written papers for the Medical Journal of Australia, and I did a doctorate in it, and then wrote a book with Sally Taylor, which became a textbook for quality and safety. And I went overseas. James Dunbar was very, very supportive at Flinders, and he was saying, well, can you go to China and run a quality and safety program for them? And I went across there for a few weeks and did that for the university. And in recognition of that, they awarded me a professorship, which was very, very nice, to get the work done, to have the work done recognised. Yeah, oh, definitely. Working here, it's I definitely feel rewarded. I've always wanted I said to my boss at the Royal Melbourne, I wanted to combine hospital administration with clinical work, and I did that for the first probably decade or so that I was here, maybe a little bit longer, working in the emergency department. But the hospitals become too complex and too busy to do that. In the latter part of my career, it was basically hospital administration was the big part. There's a bit of research that went on as well, but and a bit of teaching. But your demands, the hospitals have become more complex. The whole health field's become more complex. Things that could be done fairly easily, like appointing medical staff. It was a fairly easy process. The form might have been a couple of page form. I think the form now is 18 pages with a whole lot of supporting documentation. Well, that takes a lot of work to go through all that sort of thing, and that's been duplicated in replicated in a whole range of areas where things have become far more complicated. I think the standards are high, and people are worried about if things go wrong, that they'll get adverse publicity in the media, and things will be, community will be concerned about standards in their own hospital. So you've got to keep up to the benchmark with those sorts of things, but it's become more complicated and far more demanding too. Yes. Well, I was on the 4th floor actually. There was the sun. That's right, the sunroom, and my office was up on the 4th floor. Yes, and that was very, very different. I remember that to make changes, we wanted to have a communication between a couple of 2-bed rooms, and they had to knock out a wall or part of a wall to make that change, and the whole building shook. It was just, and they had a fire. The 4th floor didn't have a fire escape internally, so they had to build one of those. And again, it was just rock solid, the building, and doing that was just, the whole building just absolutely shook. Well, they're in there with their power drills and whatever, blasting the wall out. And it took decades. When I first came here, there was talk, well, I wasn't here in the 70s, but they were promised a new building back then. And for political reasons and whatever, it never happened. They got as far as architects' drawings, which the hospital then had to pay for with no new building. And really, it only got to the new building when they realised, well, the lifts had to be replaced and maintained, which is incredibly expensive. And they thought, well, finally we've got to build them a new building. And it was really tight, the budget, and things like the departments like the pharmacy should have been in that main building. There wasn't quite enough money to do that. And now, what are we, 24 years later, they're still in the same spot. That's frustrating. That is frustrating. They don't do autopsies and things here. So that's another thing that's changed. We had a fully functioning pathology department that could do microbiology and biochemistry and anatomical pathology. And Graham Humphreys, the last pathologist I worked with, could do autopsies and looked at biopsies and whatever. Well, that's all changed. It goes off to Ballarat and to Melbourne. It's become, a number of path labs have closed in small towns. So it's become quite centralised and a huge business, really. And one that we don't have control over, because those pathology and radiology are privatised. We can write contracts with them, but they're not our employees, and that makes it a little bit different to what it was.